it's time for a break from all the naughtiness. So healthy skin is beautiful skin. So what I think is useful to think about is detoxifying your routine. So that's a much more important way of looking at January. So that means getting rid of extraneous products which don't deliver. You know, you probably, if you're watching this channel, you know, there's lots of things that I have no time for when it comes to in the routine. So I don't like things that don't really deliver any efficacy. We're all very busy. And frankly, if I'm going to do a step in my routine, it has to kind of earn its place. So that means we should all be doing cleansing, moisturizing, and wearing SPF every day. And then any extra steps should have purpose, whether it's a leave-on retinoid at night, a redness calming treatment in the morning, or vitamin C or some other antioxidant that's really useful at helping improve our skin's protective properties, so improving our protection against the environment. 5 things you won't find in this Dermatologist skincare kit. First big no-no, and you will simply never find this in my kit, is a foaming cleanser. I have no place for this kind of product in my skincare kit. Next thing that you definitely won't find in this Dermatologist kit, and that's something I just don't tend to recommend to my patients either, are physical exfoliants. That means exfoliating products that are gritty or have texture to them. And by extrapolation, this also means devices that would equate to physical exfoliation. Next up, we have facial oils. Now, if you watch my channel on a regular basis, you'll know that I am not a fan of the oil. I know lots of you out there are and use them quite happily, but in my experience, both using them on myself and on the people I see in my practice, which is massively skewed towards the breakout prone grown-up gals section of the audience, which I know is a big audience. They just tend to cause problems. It's so hard to find oils that are convincingly non-comedogenic and won't cause concerns. We have spray-on sunscreens. Now, again, sunscreen evangelist in the house, and I like to be precise about my sunscreen. Final thing that's a huge no-no for me, and certainly something that I advocate to all my patients and to you guys, is to skip fragrance, in particular in leave-on products. Today I'm going to show you an updated morning time routine, as many of you requested. So skin pretty much bare-faced, apart from a bit of sunscreen. I've been exercising outdoors in London, which means there's probably some pollution trapped on my skin and some oil and a bit of sweat. So we're going to cleanse and then get down to it. My skin now feels clean, not tight, not red, and you guys know I'm prone to a bit of redness. So I'm going to let that dry completely. And then the next step is my vitamin C serum. So I'm using SkinCeuticals CE Ferulic today. I find this one. So next today I'm doing a Bagi Exfoderm Forte. Now I do sometimes build in alpha hydroxy acids in summer where I want a bit of extra brightness and glow. And I'm going to use a fingertip measure. You see that? Literally a line as long as your fingertip from the last crease to the end. It's a line, it's not about filling the finger space. I'll tend to always put a bit of moisturizer there and then sort of focusing on the outer surfaces of the face. I'm going to use Hydrate as a moisturizer. I am going to use my usual application technique, but I'm going to focus most of it on the outside of my face. Elta UV Clear, 2 pumps, because at the minute the temperature in London is 32 degrees and it's only 11 o'clock. So we're going to do 13 dots again. Today I'm carrying on with my demos and showing you 4 skincare mistakes I think you're probably making. I hear this from people in the clinic all the time. Dr. Sam, I'm investing in all these ingredients you've been telling me about, but I'm still not getting the results that I want to see. So here we go, applying your product consistently enough. Now, what do I mean by consistency? So if you go to the doctor and they prescribe a treatment for your throat, you get an antibiotic
Do you take 1 tablet one day, 2 tablets the next, and maybe skip it the 3rd day? I don't think so. Number 2, use it in a specific way according to the purpose of that product. I see so many people who end up spot treating or applying a little bit of retinoid here and here because that's where I have my blemishes, Dr. Sam, as opposed to treating the full face or the full field, which is usually the way to get the best results. Step number 3, we're on to absorption now. Now, you might well read in magazines that the skin should be patted gently like this. I believe you should use a firm massage to get product to absorb well. We don't want it sitting on the surface where it can potentially irritate our epidermis. We want penetration into the lower parts of the epidermis. And then the final mistake that I see people making is not giving products enough time, so not being consistent enough with usage to really determine whether or not they're doing anything positive for your skin. Now, the way to think about consistency is to think about your skin in blocks of 6 weeks. When I see products with claims on pack suggesting that they can improve things in a matter of hours, I always think, wow, that's amazing. I'm using prescription grade products in the clinic and I'm counseling patients to look for improvements over blocks of 6 to 12 weeks. So a full skin cycle, because that is the length of time for a product to influence what's going on in the layer of skin that's coming through. It's just common sense. You can certainly impact on hydration immediately, that's a different matter. But hydration is a very temporary thing. We're talking about improving blemishes, blackheads, pigmentation, fine lines, those sorts of issues. That is the stuff of weeks to months. So get yourself a consistent routine where you're using a product in a consistent amount, in a consistent distribution over your skin for a consistent period of time. As you can probably tell, consistency is quite important here. And you will see a definite improvement if you've chosen your skincare ingredients wisely.
I thought I would talk about something that I've been doing a lot in the clinic this week, and that is extracting Milia. Now, many of you will know what that is. Some of you might not. Milia are pesky little white, almost milky, pearly spots on the skin that do not budge. Often seen around the eyes or in eyelids, can also be seen in the T-zone and on the cheeks. But yeah, they're these stubborn little pearly things that just sit there and they can literally persist for years. Now, the simplest way for it to solve any problem is to prevent it. So one of the key things is to look at the aforementioned eye makeup remover. And you know, it's difficult to remove water-resistant mascara, that's for sure, and I think most people do need a dedicated eye makeup remover product. If you don't need water-resistant eye makeup, then you're probably better off. There's a greater variety of products that are not biphasic that will work for you, but I would suggest getting rid of that in the first instance. If you're getting them elsewhere in your skin, simple non-comedogenic skincare, the kind that I'm recommending on the channel all the time, brands like La Roche, Avène, Cetaphil, CeraVe are all good options and will just reduce the tendency for your skincare to promote this problem if you're predisposed to it. So things like retinoids, which are derived from vitamin A, and alpha hydroxy acids will help too. But of course that's quite difficult if you're getting them in the delicate eye area, which is the commonest place I tend to see them. So what you're left with really is extraction, and these things just won't tend to pop out by yourself. So I wouldn't advocate trying to remove these without the help of some expertise, whether that's a dermatologist or an esthetician that you see on a regular basis. It should be somebody that you know and trust and is experienced doing this kind of thing. And what we'll tend to do is to sterilise the skin and then use a sterile needle to pop them out. There's a knack to it, but I have to say it's one of the more satisfying parts of my day. So yeah, annoying, treatable, preventable.